Let's continue our discussion on face reading on cervical spondylosis. Cervical spondylosis refers to the degeneration of the cervical intervertebral discs, affecting the stability of the spine. Over time, this causes bones hyperplasia, which irritates or oppresses the spinal cord, nerve roots, vertebral arteries, and sympathetic nerves, leading to cervical spondylosis. Common symptoms of cervical spondylosis include neck and back pain, weakness in the upper and lower limbs, numbness in the fingers, difficulty walking, lightheadedness, nausea, and vomiting. The causes include the wear and tear of the neck, cervical spine hyperplasia, incorrect posture, inflammation of the surrounding tissues, and neck trauma. In the picture below, we see the facial reading of raised nodules in the cervical vertebral zone of the ear is indicated of cervical spondylosis. Curved dark blood vessels on the upper eyeballs suggest neck pain. So in this picture, we see the therapeutic methods. Unhealthy lifestyle is one of the important causes of cervical spondylosis. Patients with cervical spondylosis can massage their shoulders and cervical spine, often to relieve pain. The dietary advice would be cervical spondylosis can be the result of vertebral hyperplasia and osteoporosis. Eat foods rich in calcium, protein, and vitamins. Exercise. Participate in physical exercise that is appropriate to you. Correct bad sitting postures and do more exercises that require you to tilt your head upward. Move your shoulders often to improve the flexibility of your shoulder joints. Lifestyle. Avoid using a high pillow and sleep in an appropriate posture. Correct bad postures at work. Move the neck regularly and avoid staying immobile in a sitting position for a prolonged period. As seen in the picture above, moxibustion can be done. Symptoms of cervical spondylosis can be relieved by moxibustion. Moxibustion of the Fenchi, Dashri, cervical, Jiaji, and Jiangji points can dredge the meridians and dispel cold dampness to facilitate the circulation of qi and blood. Each moxibustion session lasts about 15 minutes. Do this once daily. The Dashri point is do 14. Next, massaging. Frequent massage of the Bailao points can relieve cervical fatigue. You can also interlock your fingers and place your hands behind the neck to rub the neck back and forth gently 50 times until a warm sensation is produced in the neck. This will relax the cervical muscles. Massage this 3 to 5 times a day, as seen in the picture above. Thank you for your attention. Interviewing. Impotence. Impotence is by far the most common sexual complaint in men, and the first cause that would come to mind would be a kidney deficiency, and especially a kidney yang deficiency. This is a common cause of impotence, especially in older men, in which case it is accompanied by backache, weak knees, dizziness, tinnitus, and poor memory. In young men, however, it is my experience that impotence is often related to a heart pattern and anxiety. In a few cases, impotence also may be caused by damp heat in the liver. So impotence in young men is caused frequently by a heart pattern rather than a kidney deficiency. Impotence should be differentiated from lack of libido. The former indicates an inability to sustain or obtain an erection. Although sexual desire is normal, the latter indicates lack of sexual desire, but normal erection. So for treatment, erectile dysfunction from kidney deficiency would be bladder 23, Ren 4, kidney 13, and kidney 3. Impotence. Kidney yang deficiency. If it is kidney yang deficiency, then impotence is feeling cold, there would be backache, there would be abundant clear urine. If it is due to heart blood deficiency, impotence would come with dizziness, palpitations, and a choppy pulse. If it is due to heart fire, impotence would be due to palpitations, insomnia, dream disturbed sleep, and rapid overflowing pulse. If it is due to damp heat in the liver channel, there would be impotence, heaviness of the scrotum, urethral discharge, and a sticky yellow coating in the tongue. Kidney yang deficiency. Impotence, there would be impotence, lower back ache, cold knees, feeling cold, bright white complexion, weak knees, tiredness, lassitude, abundant clear urination, urination at night, pale and wet tongue, and a deep, weak pulse. Acupuncture points to choose from: kidney 3, Ren 4, bladder 23, kidney 7, Do 4, and Moxa. For spleen and heart yang deficiency, there could be impotence, premature ejaculation, poor appetite, slight abdominal distension after eating, tiredness, lassitude, pale complexion, weakness of the limbs, loose stools, feeling cold, cold limbs, edema, palpitations, shortness of breath on exertion, spontaneous sweating, slight feeling of discomfort or stuffiness in the heart region. Pale and wet tongue, deep weak pulse. This type of impotence is very common, probably more so than the type of kidney deficiency. Acupuncture points would be Ren 12, stomach 36, spleen 6, bladder 20, heart 5, bladder 15, and Ren 15, and Moxa. If we have liver and kidney yin deficiency, there may be impotence, dizziness, tinnitus, weak knees, hardness of hearing, lower backache, dull occipital or vertical headache, insomnia, numbness or tingling of the limbs, dry eyes, blurred vision, dry throat in the evening, dry hair and skin, brittle nails, night sweating, dry stools, normal colored tongue without coating, and a floating empty pulse. Acupuncture points would be kidney 3, Ren 4, bladder 23, liver 8, and spleen 6. If a patient has kidney essence deficiency, the signs would be impotence, softening of bones in adults, deafness, weakness of the knees and legs, poor memory, loose teeth, hair falling out or premature graying of hair, weakness of sexual activity, lower backache, infertility, sterility, dizziness, tinnitus, normal colored tongue, and floating or empty or leather pulse if kidney essence deficiency occurs against a background of kidney yin deficiency. There would also be pale tongue and deep weak pulse if it occurs against a background of kidney yang deficiency. Acupuncture points would be kidney 3, Ren 4, kidney 10, bladder 23, bladder 52, and kidney 13. If a patient has damp heat in the lower burner, then the signs would be impotence, burning on urination, sperm in urine, difficult urination, sticky yellow tongue coating, a slippery rapid pulse. The acupuncture points would be liver 2, Ren 12, Ren 9, spleen 9, LI 11, Ren 3, Ren 5, and bladder 22. A clinical note. In my experience in young men, impotence is due more often to a heat disharmony than to a deficiency of kidney yang. In treatment with acupuncture, I treat the heart with heart 7, Do 24, Ren 15 with Ren 4. Thank you for your attention.
Let's now discuss Pian-Li, the side passage, as we continue our discussion on Han-Yang large intestine meridian. Pian-Li or LI6, is located on the posterolateral aspect of the forearm, soon proximal to the LI5 or yang. C. LI6 is the lumen connecting or junction point of the LI meridian. As the exteriorly related lumen junction point with its partner, the lung, the receiver of qi, side passage will have a harmonious action on the metal element and help restore a sense of equilibrium. The role of the Po, powered by the breaths of the lung, is to unobtrusively maintain the automatic rhythmic processes of life. When there is distress in metal, one can see extremes of behavior at every level. Mercurial changes in mood, slovenly hygiene, or obsessive cleansing, the restless quest for meaning and value, or rigid matter of fatness, sentimentality about the past, or repression of feeling. The art of the lung is to live each breath fully, as if it were complete, aided by the large intestine's propagation of the correct way of living, which, by eliminating, allows us to transform, evolve, and inspire more deeply. LI6, Pianli, joins the lung meridian and reunites and calms the first and last processes of a being. When intense or long-term disappointment in grief impairs the natural condensing action of the lung so that the upper jaw, the heart and the lungs, is constricted and the large intestine no longer extracts the value of life from the jaws, this point paired with lung 7 can release and harmonize feelings which have been repressed and are blocking the potential unfolding of an authentic life. Judgment and clarity and the natural movement of metal to stop and return us to the inside are restored. The lung opens the water passages and LI6 assists the lung in controlling this, which can be impaired in chronic lung qi deficiency or through obstruction of the way or the defensive qi. Local point for wrist and forearm problems. The name probably refers to the connecting channel which travels from LI6 to the lung channel. This point is indicated for rapid changes in mind and spirit, for extremes of behavior, and repressed emotions. It is also for facial and upper body edema due to lungs failing to control the water passages, and also for wrist and forearm pain. Consider this point for problems such as retention of urine or feces, or when a person is holding on to feelings such as long-standing grief or repressed emotion, no longer relevant to the present time. This point can help the patient to let go of this and move on in their life. This point can be used with lung 7 or lung 9 to bring greater harmony and balance to the metal element, both mentally and spiritually. This point is helpful in cases of extreme behavioral patterns or mental confusion. Patients can be dirty or unkempt, or conversely overly obsessive about cleanliness. Consider this point for wrist and forearm pain. Thank you for your attention.
Let's discuss differential diagnosis, Western and Chinese medicine, sinusitis. Inflammation of mucous membrane-lined air spaces of paranasal sinuses, often associated with inflammation of nasal lining, the rhinitis. There may be an allergic component. Signs and symptoms: there is pain, nasal obstruction, and discharge, usually yellow or green. Loss of smell, facial pain, thick mucus. Headache, sinuses, tender on pressure, feeling mossy in the head, especially in the mornings. For the acute, there is severe congestion, thick yellow or green copious malodorous mucus, may be blood tinged. Loss of smell, severe frontal, maxillary, or temporal headache, red and swollen mucous membranes. For the chronic, there is intermittent congestion, sticky yellow or white mucus, dull or thick headache with dizziness, pale and swollen mucous membrane. Number 3, possible complications. Letter A, nasal polyps, chronic nasal obstruction. Letter B, laryngitis, hoarse voice, dry and sore throat. Next, tracheitis, cough, retrosternal pain, worse for coughing. Letter D, acute bronchitis, cough with yellow sputum. Letter E, local abscesses, fever, severe local pain. Diagnosis, questioning according to number 1, excess or deficient. Congestion, continuous, meaning excess. Variable, intermittent, meaning deficient. Loss of sense of smell, transient, it is an excess. Permanent, it is deficient. Headaches, severe frontal maxillary or temporal, it is an excess. Dull or thick with dizziness, deficient. Mucus thick, yellow or green, copious, purulent, malodorous, blood stricken, it is an excess. Sticky yellow or white, not malodorous, it is deficient. Mucous membranes, red and swollen, it is excess, while the pale and swollen is deficient. Number 2, etiology, emotional stress, ongoing stress, repressed anger, excessive worry, or mental activity, grief. Poor diet, excessive consumption of greasy hot foods or sweet foods. Repeated invasion of wind, heat, or wind cold incompletely cleared and transforming into heat. Number 3, Sangpo patterns, external, wind cold invading the lung, wind heat invading the lung, or wind cold turning to heat. For the external, excess, phlegm heat in the lung, stagnation of liver qi turning into heat, liver and gallbladder fire blazing. For deficiency, lung qi deficiency, and spleen qi deficiency. Kidney yin deficiency, kidney yang deficiency. Thank you for your attention.
Let us now go to pulse taking. The topic is formation, clinical significance, and location. Pulse diagnosis is a technique of using the finger to palpate the patient's pulse and to ascertain its profile in order to assess the illness and the general condition of the patient. It is a unique feature and very important part of diagnosis in CM. The formation of pulse is directly linked to the qi and blood and functions of the visceral organs. The heart governs the meridians, and the regular beating of the heart propels blood to flow in the vessels. In response, the arteries also pulsate regularly. The pattern and the configuration of the pulsation of these beats together constitute the pulse. In CM, the circulation of blood depends upon the coordinated actions of other internal organs in addition to the heart. Lung qi acts to distribute blood, spleen qi keeps blood within the vessels, liver qi regulates its circulation, kidney qi supports its movement, and thoracic qi provides the motive force. Because of the direct relationship between the pulse and the visceral organs, the ampleness or deficiency of visceral qi and blood is reflected in the profile of the pulse. Examination of the pulse can provide information on the location of illness, its nature, the relative rise and fall of evil qi and genuine qi, and prognosis. It provides part of the basis for treatment. In the past, CM used a number of approaches to the examination of the pulse, but only one is in common use today. This approach uses the radial artery at the wrist, and both wrists are used. 3 adjacent positions at each wrist are used. These are the guan, the chun, and the qi. The guan is at the part of the radial artery directly medial to the styloid process. The other 2 positions use the guan as reference. The chun is slightly distal to it, and the qi is slightly proximal. These 6 positions, 3 at each wrist, are related to the visceral organs. Here in figure 8.3, we see the positions for pulse taking. Here in this table, we can see the correlation of pulse positions with Zhang organs. The pulse position on the left chun is the heart, the right chun is the lung, left guan is the liver, right guan is the spleen, left qi is kidney, and right qi is life gate. Thank you so much for your attention.
Let's now proceed to diagnosis according to Zhang organ patterns with pathology of liver imbalances. Anger in all its forms affects the liver, and when the liver is imbalanced, it often manifests with the person being irascible and easily angered. Anger is extremely yang in nature. It rises to the head and is explosive. People with liver excess imbalances can have a short fuse and be bad-tempered. When there is liver chi stagnation, the person can internalize their anger and frustration for a long time. When they do finally release their anger, it is often the wrong people who bear the brunt. The more heat that there is, the more irritable the person will be and the shorter their fuse. Due to its ascendant dynamic, anger can aggravate or trigger symptoms that are manifestations of ascending liver yang or liver fire. This will typically be things like headaches, pain behind or in the eyes, tinnitus, and vertigo. Stagnation of liver qi can also manifest with the person being irascible or bad-tempered. When there is liver qi stagnation, the person will easily feel frustrated and they will often be impatient. There will be frequently mood swings, and when the liver qi is not flowing freely and unhindered as it should do when the liver is harmonious. If the hun is blocked, as can be the case when there is liver qi stagnation or liver blood stagnation, or if the hun lacks nourishment, such as when there is liver yin deficiency or liver blood deficiency, it can result in depression, with the person having difficulty seeing a future for themselves. This can be seen in the eyes. It is as if they do not look outwards and instead their vision is turned inwards. This is because liver stagnation prevents the hun from being able to exit and enter freely. At night, the hun returns to the liver. If the hun is not anchored by liver yin and liver blood or is agitated by heat, it will create visions or dreams. A person mainly dreams in rapid eye movement sleep. In REM sleep, the hun is active, which can be seen in the characteristic rapid movements of the eyes whilst the person is sleeping. When the hun is not anchored by liver blood, the person can dream a lot and suffer from insomnia. If there is heat in the liver, it will agitate the hun at night and the person will sleep restlessly. They will have many and sometimes violent dreams or nightmares. Heat in the liver, particularly heat from liver qi stagnation, can cause the person to wake early and have difficulty falling asleep again. The sound in the voice that is manifestation of the liver is shouting, which can be heard when a person is angry. This can also be a more permanent quality in some people's voices. The harshness will not be as extreme as when a person is angry, but there will be a slight hardness and resonance in the voice. This will usually indicate an excess pattern of imbalance in the liver. If there is liver qi stagnation, the person can have a staccato voice that sounds a bit like a machine gun. This type of voices, through the combination of the hardness in the voice that is characteristic of liver excess imbalances and the unevenness and juddering that is the result of liver qi not flowing freely. When there are deficiency conditions in the liver, the voice will lack the shouting quality, it will be too soft and lack cloud. This will be especially noticeable in situations where the person is angry or when the voice is raised. Liver excess imbalances will often manifest with symptoms and signs in the liver's partner channel, the gallbladder channel. In these cases, the symptoms and signs will typically be hemilateral. Migraines or throbbing headaches are a typical example of this. Another characteristic of liver excess symptoms is that they are triggered or aggravated by stress, anger, frustration, and similar emotions, influences, and often manifest in the premenstrual period in women. Thank you for your attention.
Let's discuss inspection, general appearance. Robustness and fullness of the body reflect ampleness of essential qi of the visceral organs, whereas weakness and thinness reflect deficiency of essential qi of the visceral organs. In general, when the interior is ample, the exterior is robust, and when the interior is deficient, the exterior is weak. Thus, from the inspection of the general appearance of the body, the physician can infer the functional state of the visceral organs and ampleness or insufficiency of qi and blood, and the relative rise or fall of genuine qi and evil qi. Number one, robustness or weakness. Robustness means the person is vigorous, the skin lustrous and hydrated, the muscles well developed, the chest broad and thick, and the skeleton strong. It indicates that qi and blood are ample and the viscera are healthy so that the susceptibility to illness is very low. Even if such a person falls ill, the prognosis is excellent. Weakness means the person is debilitated and the skin wizened and the muscles thin, the chest narrow, and the skeleton slender. It indicates that the qi and blood are insufficient and the viscera limp. If such a person falls ill, the prognosis tends to be less favorable. The five sound organs corresponds to five tissues in the body. The liver governs the sinews, the heart, the meridians, and circulation. The spleen, the muscles, the lung, the skin, and the kidney, the bones. Thus, the state of the sinews reflects the state of the liver blood. The state of the meridians and the circulation reflects the state of the heart blood. The state of the muscles reflects the state of the spleen and the stomach. The state of hydration of the skin reflects the state of lung yin. The state of the bones reflects the state of kidney essence. Number two, obesity or thinness. Obesity is not robustness. Both obesity and thinness are abnormal. In general, a person who is obese with white and lusterless complexion, subdued mental status, shortness of breath, reduced strength, and slack muscles, has insufficiency of yang qi and accumulation of phlegm and dampness. A person who is thin with wan appearance, sallow complexion, delicate muscles, and dehydrated skin has insufficiency of yin blood and deficiency fire. Thus, the Yuan dynasty physician Su Danzi said, the obese tend to have phlegm, whereas the thin tend to have fire. Bones resembling dried wood and wizened skin in a thin patient signify that the body, fluids, and visceral essential qi are critically depleted. Thank you for your attention.
Let us now go to epigastric pain. The topic is liver qi stagnation invading the stomach. Let us look at a case history of a 45-year-old man who had been suffering from epigastric pain for 22 years. The pain radiated from the epigastrium to the right hypochondrial region. It was worse at night and better after eating. He belched a lot, his stools were slightly dry, and he felt very tired. His pulse was fine, slightly empty at the deep level in general, and floating empty and very slightly wiry on the right middle position. His tongue was red on the sides, stiff and with a slightly rootless coating. The diagnosis is also a case of stagnant liver qi invading the stomach, but with a more complex condition. The stagnation of liver qi is apparent from the radiation of the pain to the right hypochondrium, the belching, the red sides of the tongue, and the very slightly wiry quality of the pulse. Because of the long duration of the condition, the stagnant liver qi has weakened not only stomach qi, but also stomach yin. Stomach yin deficiency is apparent from the rootless coating on the tongue, the stiff tongue body, the aggravation of the pain at night, the dry stools, and the floating empty quality on the right middle position of the pulse. His tiredness is obviously caused by the long-standing deficiency of stomach qi and stomach yin. A two-stage treatment strategy was adopted. First, to move liver qi, doing it with caution so as not to injure stomach yin further, and then tonify stomach yin. It was decided to start by moving liver qi first rather than tonifying stomach yin to alleviate the epigastric pain. He was treated with both acupuncture and herbs. The acupuncture points used were selected from the following: Ren 12, stomach 36, spleen 6, used with reinforcing method to tonify stomach qi and stomach yin. Gallbladder 34 and liver 14 was used with even method to move liver qi, and stomach 21 and Ren 11 was used with even method to subdue rebellious stomach qi and to stop the pain. Thank you so much for your attention.